So I will be 50 next April, and I see the meaningful exchange of electronic health information as one of the most transformational advancements in medicine in my lifetime.
We often work with less information than we'd like.
You get things like, well, I take a blue pill, or I take the green capsule, or something like that. And that's not adequate to be able to put together a complete history.
Well, patients do definitely get frustrated. They say to me, well, it's in my record. Well, it's in somebody's record, but it may not be my record that we have at Family Health Center.
One of the things that's important for us to do is to have a way to accurately get that information and complete the history.
As a primary care provider, I have to oversee everything that's done for that patient. So I need those records, and they're not always that easily available.
I think about where we're located here in Columbia, and I think of someone driving from cross country, a truck driver, someone's involved in an accident, or someone has a heart attack and they're brought to our facility. Getting access to and knowing the underlying things in the background of that person can make a tremendous difference in that person's care.
I would be able to get a more total picture of what's going on with that patient. I can make real-time now decisions as to the next step in the patient's care.
Providers and patients benefit when the quality is enhanced, but we also see both provider satisfaction and patient satisfaction. How many times have you gone to the doctor's office and had them give you a sheet of paper and ask you the same questions over and over again?
Having information readily available would lower the risk of making medical errors, especially in medications where the patient may be taking something and you're not even aware of it, and they haven't told you about it, they haven't brought in their medicines.
It's important to be able to have a way for the information to transfer across transitions of care so that the new care providers or the current care providers can continue appropriate care for that patient as is necessary.
I really think the exchange of electronic health information is going to be one of those technologies that will decrease cost, because we won't be repeating all those laboratory tests, we won't be repeating those x-rays, those MRIs and CT scans.
The Missouri Health Connection and its promise of interconnectivity and providing information for patients in any situation that the information may be necessary has tremendous potential to save lives, as well as make sure that patients are safe in their routine and normal care settings. I'm excited and thrilled about the idea of being able to get information on demand, if you will, get information that can be critical to the care of a patient.